Brazil, Chile and Ecuador are currently reporting the highest number of COVID-19 cases in the entire Latin American region. Venezuela continues to adopt measures to combat the COVID-19 virus, while more than 15,000 Venezuelans are seeking to return to the country. Warnings from the United States referred to a moment like Pearl Harbor this week in terms of the number of expected COVID-19 deaths. From the headquarters of Telesur English in Havana, Cuba, this is From the South. I'm Katrina Goss. Chile and Ecuador are currently reporting the highest number of COVID-19 cases in the entire Latin American region. According to data from the Brazilian Ministry of Health, the death toll from coronavirus increased to over 430, while 73 deaths were reported over the last 24 hours. The figure is the highest for a single day since the first case of COVID-19 was reported in the South American giant. According to the Brazilian government, the number of infected cases surpasses 10,000. The Brazilian region most affected by the pandemic is the state of Sao Paulo, the richest and most populated in the country, with more than half of the country's COVID-19 deaths. Likewise, Chile follows Brazil in terms of the number of cases, while the use of masks will become mandatory in all transport vehicles from Wednesday, April 8th. Chile has reported over 4,800 COVID-19 cases and 37 fatalities due to the novel coronavirus. The authorities in Ecuador's most populous city, Guayaquil, say they are handing out 4,000 cardboard coffins amid a shortage of traditional wooden caskets. Forensic services have struggled to cope with the number of people who have died in the city, over 3 million since the coronavirus pandemic started, and funeral directors say they have run out of caskets. The official number of those who have died after contracting the virus nationwide stands at 180, but President Lenin Moreno has said that number probably falls short, as only the cases which have been tested are included. Guayaquil, a port city, has been at the centre of the outbreak, and residents say they have had to wait for days for the dead to be picked up. Mexican health authorities have reported over 2,100 cases of COVID-19, while the death toll in the country rose to 94. The Subsecretary of Prevention and Health Promotion of Mexico, Hugo López-Gatell, warned during a press conference from the National Palace that in 2 or 3 weeks, Mexico could enter phase 3 of contagion. López-Gatell called on the population to stay at home and maintain safe social distancing, warning that the most intense phase of the disease has not yet come. Mexico City, Mexico State and the city of Guadalajara have reported the highest number of cases, as they are also the most populated areas in the country. Bolivia is the 4th country in Latin America to declare itself in total quarantine due to the novel coronavirus. In an attempt to stop the spread of COVID-19, the de facto government of Janine Áñez ordered the complete isolation of the population in their homes. The government decided to declare a total lockdown for 14 days, which started at midnight on Sunday. The measure was announced by President Áñez after an evaluation of the national health emergency with her team of ministers. The total quarantine establishes zero pedestrian and vehicular circulation on the streets day and night. The police and the armed forces will enforce the measures, and anyone failing to comply will be arrested. Cuba has now reported 350 cases of the novel coronavirus and 9 fatalities, while Haiti reported its first COVID-19 death on Sunday. Haiti's first novel coronavirus death was of a 55-year-old man who had underlying health conditions. He was one of only 21 confirmed cases of the COVID-19 virus in the Caribbean island, a demographically young country where over half of those diagnosed with the disease have been under the age of 45. Meanwhile, Guatemala has asked the United States to limit the number of people it puts on planes for deportation back to the Central American country to 25, down from 60 to 90. 2 people had to be taken to hospital in recent weeks after they tested positive for the coronavirus upon arriving on a deportation flight. Guatemala says it is concerned deported migrants from the US, which has the highest number of cases in the world, will spread the virus to Guatemala, which has so far only reported 70 confirmed cases. Over 100 Cuban nurses arrived in Barbados on Sunday night to help in the fight against the novel coronavirus. The members of the Cuban delegation were welcomed at the Grantley Adams International Airport by the Ambassador to CARICOM, David Comisin, and Cuban Ambassador to Barbados, Sergio de Jesus Jorge Pastrana. Minister of Health Jeffrey Bostic said the 100 Cubans would be tested for the virus before taking up their duties. The Health Brigade paid tribute to the martyrs of what is known as the Barbados crime, a terrorist attack that cost the lives of 73 Cuban civilians in 1976. The Cuban aid comes just after Barbados reported its first COVID-19 death. There are 56 confirmed cases of COVID-19 in the island, while 6 people have recovered from the virus. Venezuelan President Nicolas Maduro has said the country is ready to receive more than 15,000 stranded Venezuelans who hope to return home from neighbouring countries. He also explained that more than 1,000 Venezuelan migrants had returned to the country over the weekend.
We are preparing to receive 15,000 Venezuelans migrants returning from Colombia, Ecuador and Peru. There are videos and photos on social media about their situation. All the preventive measures, they will all be tested immediately. They will take a quick test at the border. There are enough tests and we must check all of them. Those who are positive will be sent directly to the medical centers and hospitals. We have beds ready to receive them and take care of them. Those who are tested negative will go to hotels and other places reserved for the mandatory 14-day quarantine. And after that, we will do one more test. We are taking all the preventive measures in order to block any positive case from entering Venezuela.
Thousands of Venezuelans are expected to be repatriated from Colombia due to the COVID-19 epidemic through a humanitarian channel established by the Venezuelan government at migration points. Colombia's foreign ministry reported that 600 Venezuelans have already been able to return to their country. Many were evicted from their homes because they could not pay the rent. The lockdown decreed by the Colombian government prevents many migrants from earning the money to buy food and survive. The Venezuelan government has complied with all health protocols to prevent infections in the repatriation process.
We come scared because we do not know if we catch the coronavirus.
From one moment to the next, they kick us out like some dogs. Some of them couldn't even collect their clothes, their personal things, and without money on the street. And this situation is quite difficult for us to go back to our country like nothing.
More stories coming up after this short break, so don't go away. Welcome back to From the South. US Surgeon General Jerome Adams has warned that the United States will experience a moment like Pearl Harbor or 9/11 this week in terms of the number of expected COVID-19 deaths. Adams stressed that this would be the hardest and saddest week in the lives of most Americans. 3 out of 4 US hospitals surveyed are already treating patients with confirmed or suspected COVID-19. A report released on Monday by a federal watchdog agency warns of insufficient tests, slow results, a scarcity of protective gear, a shortage of ventilators for seriously ill patients and medical personnel working non-stop while anxious about their own safety. The US now has over 356,000 confirmed COVID-19 cases and has reported more than 10,500 fatalities. UK Prime Minister Boris Johnson has been moved to intensive care in hospital after his coronavirus symptoms worsened 10 days after he tested positive. The Prime Minister was admitted to St Thomas Hospital in London with persistent symptoms on Sunday. A Downing Street spokesman stressed that his condition worsened on Monday afternoon, and on the advice of his medical team, he was moved to the intensive care unit. Meanwhile, the UK has over 51,000 confirmed cases of COVID-19 and on Monday surpassed 5,300 deaths. The UK has now seen over 2,000 more fatalities than China. Widespread criticism continues of the government mishandling of the health crisis, with Johnson himself accused of downplaying the seriousness of the situation. The lockdown measures adopted came a month after warnings to prepare for the worst.
Hi folks, quick update from me on the campaign against coronavirus. First of all, in my own case, although I'm feeling better and I've done my 7 days of isolation, alas, I still have one of the symptoms, a minor symptom of I still have a temperature, and so in accordance with government advice, I must continue my self-isolation until that symptom itself goes.
Spain now has the highest number of confirmed COVID-19 cases in Europe, but the data suggests the deadly outbreak could finally be slowing. While the daily number of deaths in Spain has fallen for a fourth consecutive day, Monday's figure of 637 is the lowest recorded since March 24th. The infection rate is also dropping consistently, showing the lockdown measures could be working. The government has suggested people may have to wear masks in public after the quarantine measures are lifted. Data in Italy suggests a similar trend, while the death toll continues to be the highest in the world, standing at over 15,800. The number of daily infections and fatalities is falling, and the number of people in intensive care in Lombardy, the worst affected region in Italy, is decreasing. However, Prime Minister Giuseppe Conte has said he is not sure when the lockdown restrictions will be lifted. The Chinese government has vowed to implement tighter controls at land borders after reporting new positive coronavirus cases, while the number of asymptomatic cases also surged. The National Health Commission reported on Monday that 78 new asymptomatic cases had been identified as of the end of Sunday. Of the new cases showing symptoms, 38 entered China from abroad. Imported cases and asymptomatic patients who show no symptoms but can still pass the virus on have become China's chief concern after the containment measures succeeded in slashing the overall infection rate. The government announced that China will work to prevent cases being imported through its land borders, after noting that the number of such cases had recently exceeded cases reported at airports. Russia confirmed its biggest one-day spike in new COVID-19 cases on Monday at almost 1,000. The novel coronavirus has hit 80 of 85 regions of Russia, while the death toll climbed to 47. Over 400 people have recovered so far, according to Russia's Coronavirus Response Center. The total number of cases nationwide now stands at over 6,300. Moscow, the worst hit part of the country, is home to over two-thirds of COVID-19 cases in the country. All Russians, except for those working in essential institutions and establishments, are on paid leave until April 30th as part of national efforts to contain the spread of the virus. Germany has drawn up a list of measures that officials think should allow life to return to normal after the lockdown's scheduled end on April 19th. Measures include an obligation to wear masks in public, limits on public gatherings, and the rapid tracing of the contacts of all confirmed cases. The proposals are contained in a draft Interior Ministry action plan. According to the authorities, the measures should be sufficient to keep the number of people infected by each person below 1, even as public life is gradually allowed to resume. For this to be possible, mechanisms will have to be put in place to track more than 80% of the people an infected person had contact with within 1 day of diagnosis. Schools will be able to reopen on a regional basis, and strict border controls will be relaxed. As of Monday, the number of cases surpassed 100,000, and there have been over 1,600 deaths. Japan is to declare a state of emergency in the capital, Tokyo, and 6 other regions in an attempt to tackle the rapid spread of the novel coronavirus. Prime Minister Shinzo Abe announced a huge stimulus plan to help the economy weather the virus. Japan has a relatively small number of infections compared to other countries, but there are concerns a sudden surge in cases in Tokyo could lead to a major outbreak in the world's biggest city. So far, Japan has confirmed 85 deaths. There are now more than 1,000 confirmed cases in Tokyo, more than double the number a week ago. The state of emergency would last about a month, according to the Prime Minister. It will cover Tokyo, Osaka, and 5 other prefectures. The governors of prefectures will have the power to close schools and businesses, but the authorities will not have the legal authority to order citizens to stay at home.
We have opinions from experts that the government should prepare for the state of emergency declaration. The target areas are Tokyo, Kanagawa Prefecture, Saitama Prefecture, Chiba Prefecture, Osaka, Hyogo Prefecture, and Fukuoka Prefecture. We are looking at a period of 1 month. We need the public to cooperate more than ever to minimize contact between people that lead to infection.
South Asia has seen more than 8,000 cases of COVID-19, with India and Pakistan the worst affected by the disease. India has reported 4,553 cases and 118 fatalities. Meanwhile, 328 patients have recovered so far. The number of confirmed cases in Pakistan increased to 3,277, with at least 50 deaths, while 257 patients have recovered. Health experts warn this epidemic could overwhelm the weak public health systems in the region. With more than 1.2 million people infected with the novel coronavirus worldwide, the head of the United Nations has called for peace at home to protect women during the lockdown. UN Secretary-General Antonio Guterres described a sharp rise in domestic violence amid the global coronavirus lockdowns and called on governments around the world to make addressing the issue a key part of their response to the pandemic. Having already called for a global ceasefire in the midst of the pandemic, Guterres stressed violence is not confined to the battlefield, noting that for many women and girls, their own homes are where they feel least safe. And we're taking one final break now, but stay with us for more. Welcome back to From the South. Lebanon began to repatriate nationals who were stranded abroad on Sunday in its first flights in weeks since it closed its international airport to stem the novel coronavirus. The first of 4 planes touched down at the Beirut International Airport late in the morning, bringing in 78 passengers from Riyadh, according to local television. Many Lebanese work abroad in the Gulf or in Africa, while thousands of youth study in Europe. The Mediterranean country announced a lockdown and closed its airport from March 19th as part of measures to curb the spread of COVID-19, which has officially infected over 500 people and killed 18 nationwide. Authorities said more than 20,000 people had signed up to be repatriated in total this week or at the end of the month. Meanwhile, South Sudan reported its first coronavirus case on Sunday, one of the last African nations to confirm the presence of COVID-19 within its borders.
South Sudan confirms 1 case of coronavirus COVID-19. On behalf of the President and the Chairman of the High-Level Task Force, I would like to inform the public that on Saturday, 4th April 2020, the Public Health Laboratory tested and confirmed a case of COVID-19 in an individual.
That we're working very cooperatively with the task force and with the Ministry of Health to ensure that this case is handled well. The person concerned is in isolation and has been for a number of days pending the tests, and that will remain in isolation for the remaining 14 days. As the patient has been in the country for nearly 5 weeks, way longer than the 14 days, we need to check.
Kenyan President Uhuru Kenyatta imposed a 3-week ban on movement in and out of 4 main coronavirus-infected areas on Monday, including the capital, Nairobi. Kenya currently has over 150 COVID-19 cases and has reported 6 deaths, most of them in the capital. It is the second worst hit nation in Eastern Africa after Mauritius, which has reported 227 cases.
The Cabinet Secretary for Health has further declared the Nairobi metropolitan area and the counties of Kilifi, Kwale, and Mombasa as COVID-19 infected areas. And 3, the cessation of movement within the counties of Kilifi, Kwale, and Mombasa shall be for an initial containment period of 21 days with effect from 7 p.m. on Wednesday, the 8th of April, 2020.
Uganda has begun to distribute food aid to up to 1.5 million vulnerable citizens affected by the coronavirus lockdown in the capital, Kampala. 6 trucks loaded with bags of corn flour, beans and salt were waved off from the centre of Kampala by government ministers and sent in convoy less than 10 kilometres to Bwaisi suburb. On Wednesday, Prime Minister Ruhakana Rugunda announced the government would start providing relief food to the most vulnerable and affected by measures to combat COVID-19, initially targeting 1.5 million people living in and around Kampala. A few days into a nationwide 14-day lockdown, many Ugandans who live hand-to-mouth are struggling to buy food. So far, Uganda has reported 52 cases of the novel coronavirus. Meanwhile, the number of COVID-19 cases in Africa has reached almost 9,400, with over 440 deaths reported. South Africa has the highest number of cases at over 1,600. Algeria follows with 1,320. Until now, only Sao Tome and Principe, Comoros and Lesotho are virus-free. Iran welcomed the launch of a European barter system to bypass US sanctions as a good omen, but said it was insufficient. Britain, France and Germany said last week they had carried out the first transaction using the Instex mechanism to deliver medical supplies to Iran, which has been hit hard by the coronavirus pandemic. In the first official reaction to the development, Iran's Foreign Ministry spokesman Abbas Mousavi said the transaction had involved a few €100,000. Iran has struggled to stop the spread of the novel coronavirus, which officials say has claimed over 3,600 lives and infected more than 58,000 in the country since February 19th. Calls have mounted for the United States to ease its sanctions on Iran so that the Islamic Republic can adequately respond to the COVID-19 crisis. 3 missiles hit an oil district in southern Iraq, according to official statement. The attack took place this Monday at 3 a.m. local time, leaving 3 Iraqis injured. No material damage was reported, according to security forces. Several national and foreign companies operate in the Buhessia area, including the US ExxonMobil and Halliburton. It is believed that Halliburton was the target of the missile strike, given the proximity of the impacts to the company's headquarters. So far, it's not clear who was responsible for the attack. And we've come to the end of this news brief. You can find these and many other stories on our website at telesurenglish.net. And join us on social media, Facebook, Twitter and Instagram. For Telesur English, I'm Katrina Goss, and thank you for watching.